Good morning. Welcome to the California Crisis Intervention Training Association workshop. My name is Marla Kincaid, and I am the president of what we call CACITA, California Crisis Intervention Training Association. Today we have a wonderful program to highlight through San Bernardino County. But before I introduce the guest speakers, I would like to ask all the participants on this workshop to please mute your microphone and turn off your video. It will allow us to have a more cohesive training for all of you. I appreciate that. Thank you. Again, before I introduce our wonderful speakers that we have, I'd like to give you a little bit of information regarding CACITA. CACITA is an association made up of law enforcement personnel, our first responders through fire EMS, our behavioral health experts, counties throughout California, in addition to community members and leaders. The association looks at best practices when responding to crisis calls that have come to the attention of first responders. And today, we are privileged to hear from San Bernardino County and their CIT program. So without further ado, I'd like to turn it over to Miriam with San Diego County Behavioral Health. Thank you.
Good morning, everyone. Let me pull up my presentation and we'll get started in just a minute. All right. Okay. And Tamika, can you let me know if you can see that?
Yes, I can see it on the screen. You'll need to move those boxes, but yep, perfect.
All right, thank you.
You're welcome.
All right, so we'll get started. My name is Miriam Clark. I'm the Program Manager 1 overseeing our Crisis Intervention Training Program through the Department of Behavioral Health. We are a collaborative partnership for training in our county, and we collaborate with multiple agencies, including the Sheriff's Department and Probation, along with other community partners. And I have two co-hosts today. Stephen Scranton, can you introduce yourself?
Sure, thank you, Miriam. Good morning, my name is Stephen Scranton. I'm the Crisis Intervention Training Deputy assigned to the San Bernardino County Sheriff's Department. I'm currently assigned to the Training Division. I work in collaboration with the Crisis Intervention Training Team with the Department of Behavioral Health.
And good morning, my name is Corey Oberles. I'm a Division Director 1 with the San Bernardino County Probation Department. I oversee our 3-day reporting centers, as well as our treatment courts unit and mental health supervision unit. And I also work in conjunction with Department of Behavioral Health, and I chair our CIT committee for the Probation Department.
Perfect. So today we really want to provide you a brief overview of what we're going to discuss today. So we're going to discuss the history of the crisis intervention training programs, building collaborative partnerships to sustain CIT programs. We'll briefly discuss what that looks like here in San Bernardino County as far as our crisis intervention team training program. And we'll discuss the need of building a good crisis system of care and community supports within your own community so that we can actually make an improvement in those individuals' lives and get them into treatment rather than in our criminal justice system or acute psychiatric hospitalizations. So what is CIT? So this is not a new concept. It's actually been developed, it was first developed in 1988 when there was an incident out in Memphis, Tennessee, where there was an individual who had a very bad experience in the community, who was having a behavioral health crisis, and law enforcement didn't attend to the situation where the community believed it should have been treated adequately. So because of that incident, there was actually some civil unrest at that time, and the community wanted some change. And there needed to be some change as far as how law enforcement was trained. And so the Memphis model was what really is a CIT program was born. And it was founded by Major Sam Cochran as well as Dr. Randy DuPont. I'm not going to go into too much detail about it because you can definitely research more information on that through CIT International, which is an organization that oversees CIT programs throughout the nation and internationally. They were the original founders, and they're a great resource. So we do provide you with that link, as well as our own CASITA, the California Crisis Intervention Training Association here in California. So we are members of CASITA as well. We actually sit on the board, and we're so happy to be here today. So we're going to briefly discuss what we have found to be the 3 key elements of a successful CIT program. And those 3 key elements have been collaboration and partnerships, establishing a training program, and then building the crisis system of care or community resources to be supports in our community. So with these 3 elements, we really have developed our CIT model here in San Bernardino County. So collaboration is very, very key. It's important that we have open communication between all county agencies, city agencies between each other, as well as mental health providers, any stakeholder in the community, as well as community members. It's important that we all meet together, that we all discuss what's going on in our community, because that's the only way we're going to really know what's going on. It's better for us to work together than in working in silos. It's very important that we understand that behavioral health is everybody's issue, not just a behavioral health issue or law enforcement's issue. It's our issue. And so we really try to build on that community aspect, that this is a collaborative partnership. With our collaborative partnerships, there's expectations. We tend to establish expectations of what is needed. So through that, we have developed policies and procedures of how things are going to look like out in the field, what's expected for a deputy, what's expected from a probation officer, or for a mental health clinician out in the field. We establish clear guidelines for law enforcement and first responders when they're dealing with crisis, with somebody who's dealing with crisis, as well as our crisis staff. But most importantly, through collaboration, we see that we get to share resources. So we share personnel, we share actual physical resources, and we share ideas, which is a big resource. And we share each other's, points of view, which is actually really great because it's actually helped us develop and further and expand programs here in our county. With that, we get to also share successes and lessons learned. So we want to hear about what's working as well as what might not be working, right? So those systemic problems. So we might have a program that's doing really, really well, and then all of a sudden it's not. We want to know what's going on so that way we can fix it as a team rather than not hear about it and not address the situation. So because of that, we all get together, we all have these collaboration meetings, we're in constant communication throughout our work, that we get to really focus on what is working, but also what might not work so that we can create solutions that will benefit all, not just one agency. So just to give you an idea of how many collaborative partners that we collaborate, not just in training, but with each other for our programs. This is going to give you just a breakdown of our behavioral health or mental health partners, as well as our law enforcement partners. Another key component of our collaborative partners are consumers and family members. It's very important that their voices are heard because they're the subject matter experts. So in everything that we do, from program planning to training, we want to make sure that we include family and consumers, as well as community agencies that are the community supports in our county. So we do a great job at including the Department of Veteran Affairs, Department of Aging and Adult Services, Children's Network, our Counseling Team International, and other support systems in our county. So 2 ways that we practice collaboration in San Bernardino County, these are not the only ways, but some that are specific to our training program is that we have actually established CIT committees. And we've done that through our San Bernardino County Sheriff's Department Committee, as well as our CIT Probation Department CIT Committee. And we meet bi-monthly to address what's going on in our training program, what's working well, what is not, how to make and modify changes of maybe instructors or curriculum, and then we meet bi-monthly to also address those systemic issues that, you know, are occurring in our county, or if there's any community issues, we try to address those there so that we can figure out what would be the best course of action that we can take to remedy those situations. So some of the other collaboration practices that we do is that my team and I will actually go into the community and we'll go to various stakeholder meetings. So we'll attend coffee with the COP, with the community, to see if there's any behavioral health issues that are being discussed at those meetings, as well as our bi-monthly law enforcement collaboration meeting. We have a hospital collaboration meeting where emergency departments come in and discuss what's going on within their EDs. Campus safety symposiums, or any community task force or meeting that we're aware of, we usually try to send staff so that they can come back and we can discuss it within our CIT committees of that needs to be addressed if there's an issue going on in the community. So just to give you an idea of what that looks like, I have Stephen who's going to discuss our Sheriff's CIT committee.
Thank you, Miriam. So as you can see, our CIT committee for the Sheriff's Department was established in 2007. We quickly realized that we needed a collaboration with the Department of Behavioral Health to make this successful for our consumers. And the key aspect of this committee is that we bring together leadership on both sides of the table. You can see that we have the captain, which is the captain of the training division, is the chair for the committee. We have a lieutenant, a few sergeants, and then myself that sit on it, as well as the program managers for the Department of Behavioral Health and the deputy director of the 24-hour emergency services. And what that does is it gets us together and it really lets us talk about the successes and the challenges that we're facing, not only in training, but out in the field, and what our deputies and officers are seeing and what the Department of Behavioral Health, what their programs are seeing, so we can come together and create a better system of care for our consumers. With that, I'll turn it back over to Miriam.
Within the San Bernardino County Probation Department, we established our CIT committee in 2018, and like Stephen said, it's important for our managers and our leaders within each one of our departments, probation and DBH, to come together and discuss the things that are going on within our program. The committee is chaired by myself, the division director, over our day reporting centers and mental health division. And in that, we also have our supervising probation officer from our mental health division and our PO3s within our division to contribute to this committee. And in DBH, we also have the program manager one and deputy director, as well as the training staff that are involved in CIT through DBH. And we collaborate bi-monthly to not only discuss what is, like Miriam said, not only discuss what is going wrong within the training, what we need to fix, but also what's going right and how we can improve on that as well.
So some of the collaboration successes and outcomes that we have seen within our program is that not only have we expanded our CIT program of who we actually train, but we've also been able to implement some changes as far as adding a CIT deputy, which is Stephen Scranton, sitting here today. We were actually able to bring him on board as a full-time CIT deputy. Additionally, we were able to expand or make modifications to our crisis system of care. So our crisis programs, we've been able to always bring in the law enforcement or first responder voice and implementing those programs and evolving them and making sure that they are meeting the need of our community, as well as making sure that they're programs that law enforcement can utilize out in the field, or take someone to that's going through a crisis that doesn't meet the level of a 5150 or 5585. We've been able to implement treatment programs and engagement programs. In the bottom left, you'll see that we have our recovery-based support team, which is a really great program that is really focused at engaging our individuals who are hard to engage after maybe they've been hospital multiple times, but they're just for some reason not going into treatment. We really try to focus on those individuals. And then we have our innovative remote on-site assistance, which is a collaboration with multiple departments within our county, including law enforcement partners, to deliver services and treatment services and engagement services to the most hard to find remote areas of within our county of those individuals who are actually homeless. So I'm going to discuss more about our crisis system a little bit later. So I'm going to pass it over to Stephen, who's going to talk about some of the successes and outcomes from the Sheriff's Department.
Thank you, Miriam. Yes, so from the CIT committee, one of the ideas that came out of there is a CIT form. What does that mean for our deputies on the street is that anytime that they can identify a call for service that is related to a crisis, they fill out a CIT form. And what that does is that gathers the biographical information of that person along with their past history and the current behaviors that they are noticing and that they are seeing at the time of their contact with them. They fill out this form. That form then gets emailed to the Department of Behavioral Health, who then routes it and keeps track of it, and they send it to those triage engagement and support teams that are embedded with each station. That allows those test team members to go out and follow up with that person and keep a caseload on them to help reduce the recidivism of those people and those calls for service for our deputies. So that's been a big success in just providing that better system of care to the consumers when they're in crisis and then helping to follow up with them. We also have our homeless outreach and proactive enforcement team. They are key in our success with dealing with our homeless population. We have our Sheriff's Transitional Assistance and Reentry team, which is a corrections-based team. And what they do is they meet with inmates and they develop a plan for a successful reentry into the population after being released from custody. That helps reduce the recidivism of them being reincarcerated. That'll turn it over to you, Corey.
Thank you, Stephen. As I previously said, we operate 3 day reporting centers within the county, one in Victorville, one in Fontana, and one here in San Bernardino. And these are designed to be one-stop shops so our clients can receive and be referred to the various services all contained within our building. Within each one of our DRCs, we have co-located collaborative partners. I knew I was going to screw that up. Co-located collaborative partners with DBH, choosing healthy options to instill change and empowerment, known as CHOICE. And they offer mental health and SUD services to our clients. We also have a public health nurse who is on site in each one of our DRCs 1 day out of the week. And she conducts health classes and informational sessions with our clients. We have 5 Keys Charter School, which offers continuing education for those who may have not gotten a high school diploma or high school equivalency or GED. We have TAD to assist with Medi-Cal certification, getting driver's license, food stamps, or obtaining a birth certificate. And we also have workforce development on site, and in each one of our day reporting centers, they hold 3 day seminars with our new clients so they can go through filling out an application, writing a resume, learning how to properly conduct an interview, as well as job search and job placement. Also recently too, we had an officer assigned to the Sheriff's Hope team, and they work giving out the services to our homeless within each one of our areas. And we have officers that are assigned to each one of the jail facilities that work with the START team to ensure that we can get transportation from a custody setting to our day reporting centers for those clients who need assistance with that.
All right, so our second element that we want to focus on is obviously our CIT training component. And just so that you're aware, the Memphis model basically says that 40 hours is the ideal model for training for law enforcement to receive for behavioral health, intellectual disabilities, developmental disabilities. And there are certain components that are required in that. However, that might not be the case for wherever you are at. You really have to look at what are your strengths and what are your weaknesses? What are the assets that you have, resources that you have available? We didn't start off as a 40-hour class. We actually started off as a 32-hour class, and we actually just recently changed that to a 40-hour class in September of 2019. We did do a couple initial 40-hour classes at the very, very beginning, but we really realized that we really needed it to be a 32-hour class. So you need to really focus on what time you have available, how many instructors you have, and what is the content you actually want to teach. But what we found successful and what is actually really highly needed is that you want to make sure that you have law enforcement leadership involvement at all levels, not only in your pre-planning phase of training, but also included in your actual delivery of training. We try to always have a captain or somebody in leadership come in and actually start and welcome the students into the classroom. So we want to make sure that it comes, that there's a welcome message from them saying that this is an important topic that needs to be addressed and that it's an expectation of the department. So we always try to make sure that we have leadership from probation, from the sheriff's department, or fire, if we're doing a fire training, that there's leadership involvement at all levels. The other major element that we try to emphasize is that we want to make sure that we develop and that we have great training instructors, that they're dynamic and that they are subject matter experts in their field, because they will be hit with very hard questions at times from law enforcement or first responders. So we want to make sure that they're not only experts at their field, but that they're dynamic. There's nothing worse when you have somebody just going over a PowerPoint and they're reading off of it, or they're very monotone, or there isn't any discussion or engagement with the audience. We want to make sure that whoever we're having present, that they are also making sure that they're delivering the content in a way that is teaching our first responders how it's going to be applied in the field or the correctional facility. Because if it's information that they feel they can't apply, or they can't actually take away something with them, they're not going to retain that information. So we always want to make sure that our instructors are dynamic, because it really doesn't matter if you have a PhD, if you have, if you're a licensed clinician, you could be very smart in what you do, but it doesn't make you a great instructor, then it's not going to be effective. So we want to make sure that whoever is going to actually teach the content is not only a subject matter expert, but they're great instructors. We want to make sure that we are always doing adult learning styles. We have to understand that when working with first responders, they bring a lot of knowledge with them, and they have a lot of life experience, especially if they've been a first responder for a very long time. And they have a lot of knowledge that they can bring, especially to our newer law enforcement or other newer first responders. So we want to make sure that we are giving them time to have group discussions, that they are able to share their own experiences. So we try to use a variety of different learning styles, from presentations to discussion groups, learning activities. Two of the most important that you'll hear through the Memphis model is site visits. So we actually take them to our different resources in our community so that they can not only see what the services that they provide to our community members, but they can also network with those individuals so that they feel more comfortable taking somebody to those facilities, and they know exactly what kind of services they're going to receive. In addition, with our role playing, which you'll see in a little bit in the video, you're going to see that we do role playing. That's a very important aspect that we really try to incorporate into our 40-hour class, because they have so much content within that entire week that we want to make sure that they can retain that information. And role playing is a great way for them to practice the skills that they've learned throughout the week. And it's also very important that they are going to get credit for taking this class, especially if it's a 5-day class or an 8-hour class. We want to make sure that we have it post-certified or STC certified if it's for probation or the correctional facility. So those are two of the most important accreditations that you want to make sure any training for law enforcement is done. And if you're dealing with fire, you want to make sure that they can also get continuing education credits as well. So like I said, I actually have a full team, and didn't have a full team until 2017. Before 2017, there was only one mental health education consultant that kind of helped navigate the CIT program. But we started getting a lot of more inquiries about getting training out to different agencies. So we wanted to make sure that we, within our county, were able to meet the need of all of our law enforcement and first responder partners. So we did an expansion in 2017, which is under Dr. Yoshioka, who is the Deputy Director of 24-Hour Emergency Services. And so we're under her division. And so within our CIT program, we have a Program Manager 1, We have 3 staff training instructors, a mental health education consultant. We have Stephen, who is our CIT deputy, who gives us a lot of first responder insight. And then we have Michelle McDonald, who is our office assistant 3, a social worker 2, and 1 mental health specialist. So not only do we provide training to law enforcement, we also provide training to our community partners. So fire, paramedics, EMS, emergency departments, district attorneys, public defenders, city personnel, schools, and other community agencies. So pretty much anybody who fits in the first responder community, as well as those community partners that interact with first responders, we want to make sure that we provide them training of our content. So we'll go over those training topics in a little bit. So just to give you an idea of what a person may experience when they attend one of our classes, I wanted to show you a video of our 40-hour CIT course.
In 2008, the San Bernardino County Sheriff's Department and the San Bernardino County Department of Behavioral Health established training for law enforcement personnel entitled Crisis Intervention Team Training, or CIT. The CIT program is designed to establish the foundation necessary to promote community behavioral health solutions and to teach law enforcement personnel how to provide professional assistance to individuals experiencing a behavioral health crisis.
All deputies upon graduation from the Academy complete crisis intervention training. They are also offered additional training throughout the course of their career. Deputies are trained to identify citizens in crisis and coordinate the appropriate resources to resolve a variety of calls, such as a person who is a danger to themselves or others, or a person who is unable to understand or communicate their needs. Since 2008, the CIT program has trained more than 2,000 officers.
Because law enforcement officers are often the first responders to a behavioral health crisis, it's imperative that they have the tools they need to act appropriately in these situations. CIT training educates officers about the resources available to accelerate the process of helping people get the behavioral health services they need. There are 4 main components of CIT training: identifying behavioral health conditions, learning and practicing de-escalation and conflict resolution tactics while keeping officer safety in mind, familiarization with behavioral health resource sites and locations, and engaging in various role-playing scenarios in order to utilize the skills students learn throughout the course. The behavioral health conditions component of CIT gives an overview of behavioral health disorder signs and symptoms like depression, bipolar disorders, schizophrenia, anxiety, or personality disorders, in hopes to teach law enforcement officers what to look for when they come in contact with someone who may be in crisis.
One of the great components of the CIT program is that we bring in consumers and family members to share their story and their journey of recovery. As a result, law enforcement is able to gain an insight and understanding of the daily struggles of people with behavioral health conditions.
Aside from training deputies on the behavioral health aspect of law enforcement, a unique piece of our training program is that we teach the deputies about resources available to them and their family for their personal wellness. We talk to them about our counseling team, peer support, and chaplain services, and what they can do to help. As law enforcement officers, it's very important that we understand our own stressors and be aware of self-care practices.
The interactive exercise component of CIT training allows students to practice de-escalation and conflict resolution tactics while keeping officers' safety in mind. Students must interact with role players who pose as someone who is experiencing a behavioral health crisis. Students also participate in a simulation of what it might be like experiencing a behavioral health crisis from the consumer's point of view.
The person with the bag in their head, you guys enjoy the scenario.
This exercise is designed to be a fully immersive experience that allows the deputies to step into the shoes of someone who may be suffering from a mental health crisis. And it overstimulates the senses, and when they come out of this scenario, they're able to better communicate with someone out on the street going through that mental health crisis. It allows them to use the TACT model of tone, atmosphere, communication, and time, and be effective when they contact somebody out on patrol.
Ma'am, deputy rating. Ma'am, deputy rating. Come on, ma'am. Talk to me. What's your name?
I'll take you with
What's going on? I'm here to help you out. Jenna, talk to me. Stop yelling at Jenna, guys. They told me I'm gonna kill you. I'm gonna kill you. I'm here to help you out.
That's not what they're saying.
I don't know what they're telling you.
I put the bag on my head, and immediately it almost drowns out sound. And my first thought was, obviously there's going to be something coming from the sides if they're already blocking my ears and the back of my head. So it made me paranoid of what was going on around me to begin with. And somebody came up from my back, and it's very hard to focus. I was getting frustrated, and I think even a few times I screamed because I just felt like if I screamed, maybe everything would stop.
In addition to class exercises and lectures, students visit various behavioral health resource sites, like the Crisis Walk-In Center, the Transitional Age Youth Center, and the Family Resource Center and clubhouses. Here, they actively engage with individuals in recovery through activities such as playing pool, cooking a meal, or playing interactive games. During these visits, they learn about the services and resources provided at each location.
Yeah, coming here today and talking to these people that are dealing with mental health issues has really changed my view. After interacting with them, found out that they're actually normal people. They have problems like the rest of us, and they're just looking for help and a way to interact with the community better. Maybe they felt like people don't understand them, and that's all they're looking for: friendship, community, that sort of thing.
In the final component of CIT training, students engage in various role-playing scenarios utilizing the skills they have learned throughout the course. The key objectives here are to demonstrate officer safety while focusing on rapport building, recognizing behavioral health indicators, using de-escalation techniques, and identifying appropriate crisis response and diversion services. Students then debrief with law enforcement and behavioral health evaluators for constructive feedback.
The goal of CIT is to develop strong partnerships with local law enforcement and other first responders in order to increase awareness and educate on behavioral health issues. By working together, we can focus on resources and services to reduce unnecessary hospitalizations, the use of jails as alternative housing, and ultimately decrease recidivism. By providing these trainings, we hope to enhance the skills of our deputies, paving the way for them to work in our communities armed with a better understanding of behavioral health.
All right, so that was just a overview of our what you might see in our actual CIT training. So Stephen, do you want to go over our sheriff post-certified classes?
Yes, thank you, Miriam. So we have two different trainings that we provide. One's the 40-hour course that was just shown in that video. We also provide an 8-hour field training officer course. All of our field training officers are required to take that under Assembly Bill 29. Every 3 years, they're required to take that. And they're really the first ones that are teaching our deputies when they get out to patrol how to handle these crisis calls for service. So it's important that they get refresher on mental health training so that they can relay that to the deputies that they're also training. But our main components of our training is the mental health overview. We teach deputies to recognize their own mental health and how that affects them in their day-to-day job and how that affects their ability to de-escalate a situation. We also bring in a lot of personal stories, which kind of nails home the point of how this can affect anyone and everyone. And then we teach them the de-escalation tactics, and we also, once the crisis is stabilized, where to take that consumer and the resources that they can provide to them.
So for that training, this is just a slide to show you that we've trained over 2,800 individuals in some type of CIT training course, be it our 32 or 40-hour class or our FTO class. And just so that to give you some reference, we did have one 8-hour class prior to 2016 before we had the mandate of SB 29. So we're constantly looking at what trainings need to be modified to meet the need of the current time that we're in. And then I'll pass it over to Corey, who'll talk a little bit about our probation CIT training program.
Thank you, Miriam. As stated, we began our CIT training for our department with one 8-hour course that was in fiscal year 2016-2017. And within that class, it gave a mental health overview for both adults and juveniles. We had discussions on psychiatric medication and those that were experiencing episodes of excited delirium or hearing voices. Our actual CIT program kicked off in 2018, 2019, and it is very similar to the Sheriff's Department's 40-hour training course. But with our department, we have broken it up into five years with one 8-hour course per year for our officers. In the first year, we discussed, once again, a mental health overview. We had exercises and scenarios on verbal de-escalation skills and tactics and things like that, and how to deal with these folks that are experiencing some of these episodes. We also had a consumer panel, and we discussed the various resources that are available through DBH within our communities for our officers. Year 2 started in 2019, 2020, and we expanded on that from the first course with the mental health overview and discussed specific diagnoses. And then we also did our site visits to the various CSUs and CRTs within the community. And for our correctional officers, they had specific mental health overview as well, and then dealing with developmental disabilities, as well as a site visit to the Inland Regional Center. Year 2 and year 3 have been adversely affected by our global pandemic. We should currently be in year 3 of our training, but that has been suspended until we start to improve our numbers within the county. One of the things that we have also been helped with is when we have new officers that come to our mental health supervision unit, they have the ability to attend the actual 40-hour course that's presented at the Sheriff's Department, so they can get all of that training right up front and be able to use those services out in the field when they're contacting their clients as well.
All right. So as far as the CIT program, just so that you are aware, any law enforcement agency personnel are able to attend the 40-hour course, as well as all first responders. So it's not just, even though it's hosted between Department of Behavioral Health and the Sheriff's Department, it is open to all agencies. Along with our CIT expansion of 2017 and fiscal year 18, we are also responsible of training our collaborative partners that deal with our law enforcement or first responders with individuals who are experiencing a behavioral health crisis. So we like to collaborate a lot with our different fire departments, our EMS system, our schools, our hospitals, and other community-based organizations, and we will work with them to develop training specific to the needs of their agency. So we'll oftentimes develop trainings on stigma, behavioral health overview, the 51, 50, 55, 85 process, trauma, self-care, suicide prevention, verbal de-escalation, and we always try to incorporate training on our system of care, because we want to educate the community of the resources that are available in our county that they can tap into before they have to call 911. So if they can handle that crisis and actually get that individual to one of our resources, we want to educate them on how to do that. So on the right-hand side just gives you the numbers of how many individuals we train per fiscal year. In last fiscal year, we had 29 community trainings, and we were able to train 861 community partners. So again, the third component of establishing a good CIT model is that you want to make sure that you have a crisis system of care where our first responders are going to be able to involve, so that we can reduce acute psychiatric hospitalization, we can reduce the criminal justice involvement, and we can reduce the time that law enforcement spends on behavioral health calls. So we want to make sure that there's a good system of care in place so that they can tap into those resources, and as well as educate those community members of what are the alternatives of calling 911. So here in San Bernardino County, we have our crisis system of care. And what we hear is that 911 gets called, and we want to make sure that there's a crisis system of care that they can tap into. So on the left-hand side, you have our crisis services. And I'm going to go into some of these specific programs a little later, but I wanted to give you an idea of the crisis services that we have in our county. So we have the Community Crisis Response Team, Triage Engagement Support Team, Crisis Stabilization Units, Crisis Walk-in Centers, which those two serve as like a psychiatric urgent care. And then we have Crisis Residential Treatment Facilities. On the right-hand side, you have our community support programs. So once they're in our crisis system of care, what's going to usually happen is once they've done the crisis intervention, some stabilization, is that they're always going to try to link them up to community supports. So that can look like treatment, it can look like a clubhouse, it can look like some other county department for stabilization. So we want to make sure that we provide them with resources so that they can maintain their journey of recovery out in the community. So of course, every situation is different, so they're going to involve different programs. And the right-hand side only has a few of those programs that they might tap into. We have a lot more, but they just didn't fit in my diagram. All right, so one of the first programs that I do want to talk about is our Triage Engagement Support Team. And this is an awesome program because we have co-located DBH staff who work specifically with law enforcement agencies throughout our county. And they provide different services such as crisis intervention. They provide 5150 and 5585 voluntary psychiatric transportation to those sites. And they'll sit with that individual as long as they're nonviolent or not aggressive, or that they might flee. They also provide case management services. So once an officer or a deputy calls that individual out, and they feel like that person might benefit from case management, they can hold a case for up to 90 days. They'll provide that individual with referrals and community support programs. They'll provide education to the family and caretakers because oftentimes that's needed. They'll advocate for the consumer to make sure that they're getting the help that they need. And they're always a great support to our law enforcement agencies that they're co-located with. So currently right now, they're co-located in 15 sheriff stations, 8 city police departments, 2 college campuses, 3 emergency departments. They're co-located in one of our probation offices and one of our public defender's office. So on the right-hand side, you see, I wanted to provide you with some little stats. So these stats are the number of calls that they receive from law enforcement specific to potential 5150s. So initial calls. So 80% of those calls were able to be diverted and only 20% had to have a hold written. So what happens is once they've done that initial call, if they're able to manage the case, then they will open up the case. So for fiscal year 18-19, they had 1,644 interactions with actual cases open. And from those cases that they actually managed within that 90-day period, 99% managed in the community through case management and referrals. Only 1% actually had to have a hold written during that period. On the center box, Stephen mentioned that deputies complete a CIT form anytime that they encounter a mental health or behavioral health crisis out in the field. They're required to complete that form. That form gets emailed to those social workers within our test co-located sites. and they provide the follow-up on those CIT forms. So they're trying to constantly link those individuals to support programs or treatment programs so that they can maintain in the community. Another crisis system of care program that we have here in our county is our community crisis response team. And we have 3 great programs in 3 different regional areas. So we have one in our East End, our West End, and our high desert communities. And they're available 7 days a week, from 7 a.m. To 7 p.m., 365 days a year. So they're always open. And they respond to all calls, including law enforcement. So they respond to calls from schools, families, different community agencies. So anybody in our county is able to call CCRT when they're dealing with somebody who might be experiencing a behavioral health crisis. And they do the crisis intervention. They'll assist law enforcement with the assessment, with the transportation, again, provide a lot of education referrals. And they also do a great job at doing critical incident and disaster response in our county. So for example, right now we're going through the global pandemic, and they've been so instrumental on servicing and providing services to our skilled nursing facilities because there's a lot of stress and anxiety going on. So they're able to assist those agencies on a task force to provide those services and some interventions. So on the right-hand side, you have the number of calls that they've received for fiscal year 1920. So out of 5,771 calls that they received, 64% of those calls actually were not really crisis calls. They just needed referrals and linkages. And 36% were actual legitimate crisis calls. Out of all those calls, 832 calls were actually law enforcement disposition, were actual calls from law enforcement. And out of those that were law enforcement, 47 were not crisis calls, but actually just needed referral linkages, whereas the remaining were actually crisis calls, and we were able to divert 26% to other resources that were not a psychiatric hospital. 5% we were actually able to work with them and get them to voluntarily hospitalize themselves, and 22% we actually assisted with the 5150, 5585 hold, either writing it or transporting that individual. Another great program that we have here in San Bernardino County is that we have 2 crisis stabilization units in our county. One in Fontana, which we call Merrill, and one in San Bernardino, which we call Windsor Center. And they're voluntary, unlocked 24-hour psychiatric urgent cares where people ages 13 and over are able to receive services such as crisis intervention and stabilization during that time, have some therapeutic supports. They'll do a psychiatric evaluation, and if they need medication, they might provide that or a prescription. They have a great peer-to-peer program so that they can engage with that peer who's been there and get that support. And then, of course, they'll integrate some substance use disorder services and case management if that's needed, and they'll provide other community supports as well. So on the right-hand side, you have some stats of the number of law enforcement referrals that were received from each of those facilities. So Merrill Center received 343, so that's 21% of the total referrals that were received through Merrill. And they received through Windsor 359 referrals, that was 19%. For fiscal year 1920, Merrill Center and Fontana received 655 referrals from law enforcement. Windsor received 352 referrals from law enforcement. So Merrill 23%, Windsor 14%. So we did see a small decrease in Windsor Center. That doesn't necessarily mean it's a bad thing. That can mean actually a good thing. Of course, one of our main goals through the CIT program is also to educate community on what these resources are and how they can directly take their family members or loved ones to these facilities. So if we can educate the community and to navigate our crisis system of care better, we want to do that. So that way we can leave our law enforcement partners to respond to other crisis calls. So at this point, I'm going to hand it over to Corey, who's going to talk to you about the mental health unit from probation.
Thank you, Miriam. Within our division, we have our mental health supervision unit, and this unit is comprised of officers who have cases on their caseload that are diagnosed with mental health conditions and are open to choice services within our DRCs. Our goal is to take all of the offenders that are on our caseloads that are receiving choice services into the mental health supervision unit. Some of the ones we don't take are those that are assigned to a DV caseload or a sex offender caseload, as they are specialized caseloads that are supervised by their officers only. Our mental health officers, they work hand in hand with choice services to ensure that our offenders are not only following the rules of probation, but also following along with the case plan that has been set up for them for their psychiatric or mental health treatment. As I said, our officers supervise our clients within the community, and some may be living at home, some may be living in contracted housing and or also homeless as well. Our officers are also a part of the custody community aspect for our clients, that for those that are transitioning from being in custody and living back in the community. We work with the community partners in this committee to ensure that they have adequate transportation from the jail facility to our day reporting center, so they could be linked to services and linked to our officers. In fiscal year 2020-2021, we had approximately 259 probationers on our mental health supervision caseloads. It says that approximately 38 of them are homeless. We have about 54 that are in housing, and approximately 119 that are receiving either mental health or substance use disorder treatment.
And so at this point, we have reached the end of our actual presentation. I just wanted to thank you for having us present on our CIT program. We hope that you've learned something and taken something from this presentation. And we also want to let you know that we are a resource if you are a city or a county or a community that is interested in starting a CIT program. Please feel free to reach out to us, and we will do our best in helping you navigate that, the process of initiating a CIT course, or establishing a CIT committee, or establishing some type of system in place. So again, thank you so much for listening to us. And if you have any questions, please feel free to let us know. I believe you have the option to raise your hand to ask questions.
Before you get started, Miriam, you did have one question. It was more clarification for the CCRT. Is it 7 a.m. to 7 p.m.? Because it looks like the question states that they are currently 7 days a week till 10 p.m. So they just wanted clarification on the time.
They're open 7 days per week, so 365 days from 7 a.m. to 10 p.m.
All right, thank you. So at this point, I believe if there isn't any questions regarding the program in itself, we do have a group of panel experts within our county. If you have any questions for them, let me introduce them. And if you have any questions for their programs, please feel free to ask your questions in the chat feature. So I would like to first introduce Lieutenant James Porter with San Bernardino County Sheriff's Department. Lieutenant Porter, if you're there, if you can let us know a little bit more about you. Okay. We'll move on to our next expert panelist, Sergeant Kevin Arlotti with San Bernardino County Sheriff's Department. Hi, Kevin.
Good morning, everyone. I hope it looks like it's working right now. I'm glad that you're all able to participate today. I just want to tell you a few things real quick about me. really 4 things that I'm very lucky to be a part of. Number one, I've been able to work at 4 different jail assignments, 8 different patrol stations, and then 3 different training assignments in 23 years. So, and number 2, I've been lucky enough to survive a broken neck and some other broken bones and still keep working. And number 3, I've been part of 2 nonprofits I'm very proud of. One that helps the families of all fallen peace officers around the country, and then one, the Resiliency Project, that helps with the silent suffering of all of our first responders. And the last one, and the luckiest thing I've been able to be a part of, is the collaboration that makes up the CIT Crisis Intervention Team program since 2008. Like Miriam said, my name is Kevin Arlotti. I have 23 years on with the San Bernardino County Sheriff's Department. I'm currently a sergeant assigned to our Barstow Station, which has 9,000 square miles of coverage area. And we definitely utilize all of the components of the Crisis Intervention Team program and collaboration efforts to lead to success out in that area. I just wanted to share one quick aha moment that I had. Was really in the very beginning when in 2008 when I was able to attend the first 36 or 32-hour training. And at that point in time, everyone at the training division, a lot of people in our department thought that we were all, as law enforcement officers, trained and experienced enough to deal with these incidents of crisis out there. And everyone thought they were experts at it. And once I saw all of our employees, our deputies go through, and I went through those scenarios myself, I realized that we need a lot of training in this area. And I've been happy to see that our training's evolved over the last 12 years. And we are definitely at a pinnacle at this point, and I see us still moving forward. Thank you, Miriam.
Thank you, Kevin. And our next subject matter expert is Deputy Steven Scranton.
Well, like you said earlier, I'm the Crisis Intervention Training Deputy. I've been doing this, we've had this position for a little over a year now. I work directly with the Department of Behavioral Health's Crisis Intervention Training team. I also serve as a liaison between the Sheriff's Department and the Department of Behavioral Health. My office is located in the Department of Behavioral Health's administration building, so we have that direct access to between the 2 departments. That's a little about me, and I'll turn it over back to Mary.
And our next subject matter expert is Lieutenant James Porter with San Bernardino County Sheriff's Department. If you can share just a little bit about your current position.
Hi, everyone. Sorry, I literally stepped away right at the worst possible time, apparently. I am the lieutenant assigned to the Crisis Intervention Program. My role is more at a policy and management level, just making sure that our policies align to the current best practices and that our deputies get the training and use the services that are put out through the program to all of the stations. And then in real life, my full-time assignment is with the Inmate Services Unit, and we provide for all of the vocational, rehabilitation, spiritual, and all of the self-development needs for the county's jail population. And we are working on merging some of those programs into this, having crisis intervention be a part of that.
Thank you, Lieutenant Porter. And our next subject matter expert is Corey Oberles with the Probation Department.
Hello again, my name is Corey Oberles. I'm a division director with the San Bernardino County Probation Department. Been with our department for approximately 23 years, and I've been working in the capacity of our day reporting centers and mental health division for almost 4 years. And I act as a liaison between our department and Department of Behavioral Health on a couple of different areas, one being CIT, the other one also being our DRC services and choice.
Thank you, Corey. And we also have Erica Rivera, probation officer with the Probation Department. Erica, are you there? Okay, I don't hear from Erica. We'll move on. We have Julie Hill, who's the senior program manager with Department of Behavioral Health.
everyone. So I am, as Miriam said, the Senior Program Manager under Dr. Georgina Yoshioka with our 24-hour and emergency services division. And I oversee our contracted providers that provide the crisis residential treatment services. We do have 4 of those. We call them our adult programs, even though we have the transitional age youth, which is technically 18 and over. But that falls under our children's division. There are also 2 crisis stabilization units, as Miriam indicated in her presentation, and 2 crisis walk-in clinics. They are the same thing and provide the same services, they just have different names. And these contracted providers do work closely with our law enforcement partners and our probation partners to provide those voluntary services for those experiencing a behavioral health crisis and are willing to get treatment either at the acute stabilization, or they can go to the crisis stabilization unit or the crisis walk-in clinic for up to 24 hours and then either be released to a lower level of care, or they might need inpatient care at that point, or to receive services at our crisis residential treatment facilities, where they can get really a whole variety of services while they are in that residential treatment. And it's a 30-day program with the option for 2 30-day extensions, which would be for a maximum of 90 days in that crisis residential treatment program. These programs have really filled a gap in the middle range, if you will, of crisis services from the outpatient and our mobile teams that are also so important, and our inpatient. So these programs are the mid-range for voluntary, less imminently dangerous to self or others that can be managed at more of this outpatient level. So some really critical programs that we have had up and running for anywhere from about 3 years to about 18 months. So we're really excited about them.
Thank you, Julie. We'll try to Erica again. So Erica from probation. Hi, Erica.
Hello, everyone. I'm a professor here at the San Bernardino DRC, and my job here.
Oh no.
Here is just to facilitate different services that DBH provides here at the DRC, and just ensuring that they're able to do their psychiatrists if they do, or make up with their doctors, case managers, caseworkers, help with getting their medications, just basically getting all the resources to them and making sure that they're aware of them and that they're available to them.
Thank you, Erica. All right, our next subject matter expert is Erin Zamora with Department of Behavioral Health.
Hey, I'm Erin Zamora. I am the program manager too, and I oversee the community crisis response teams. And just reiterating everything that Miriam covered in her presentation, we're in 3 regions, the High Desert, East Valley, and West Valley. And we are a field-based crisis response team. So we are heading out 7 days a week, 365 days a year from 7 a.m. to 10 p.m. And we are supporting law enforcement, schools, families, anyone in the community who's experiencing a psychiatric need. We could go out and evaluate to see if they are needing hospitalization services or if we could support them at a lower level of care. Thank you.
Thanks, Erin. And our next subject matter expert is Vivian Bermudez with Department of Behavioral Health.
Okay, good morning. Hi, I'm Vivian Bermudez. I am the program manager too for the triage engagement and support teams. Miriam did a beautiful job in describing what we do. So in a nutshell, we provide crisis intervention services and intense case management services to the residents in San Bernardino County. I'm sorry, I am sorry about that. I had a cat in the way. So the thing that I want to emphasize is that we do respond in the field with law enforcement specifically because we are co-located with them. And the things that stand out about our program, focusing on the success, is that the fact that we are embedded in these sites for law enforcement, which at this time currently is the 15 sheriff stations and 8 police departments. We are driven to assist law enforcement, which helps in saving that time that they spend, that they would spend in behavioral health crises, and then being able for us to take over that, help them, and then they can go on with the safety in the community and dedicate their time to that. The collaboration, communication, and engagement with the sites, being able to be there with them has been very, very successful in the productivity of this program. I've been managing it for over, give or take, the last 2 years, and it's been a privilege to be able to develop it from 9 sites to almost 31 at this point. Also, the component of case management, that we not only do the immediate crisis intervention and give out the referrals, we also take those cases and then we follow them until we can do what we call a soft handoff on linking them and being sure that they are stable enough to be able to let it go. And this helps in reducing the recidivism of these calls and helping them stay linked into those resources. Thank you.
Thanks, Vivian. So we wanted to have these subject matter experts here for you today so that you guys can ask any questions regarding the law enforcement collaboration or collaboration with probation and the services that they've developed, as well as our crisis services here in San Bernardino County, as well as obviously our training program for CIT. So if there's any questions, we are here to answer any questions that the audience may have. So please feel free to ask any questions.
And it looks like, Miriam, you did have a question that was sent. It says, does CCRT respond in patrol deputies' cars or on their own minus law enforcement? That was a question from a participant.
And I'll have Erin answer that.
Yeah, so oftentimes law enforcement will, if they're seeing that there's a need for CCRT to come out, then they'll give us a call. And we'll head out in our own county vehicle that happens to also be caged. And so we'll meet law enforcement at the scene. And one of the main reasons for that is because if this individual does need to be held or transported somewhere else, and they're safe for us to transport, then CCRT will go ahead and handle the transport to the hospital, to the walk-in center, to a stabilization unit. And that allows law enforcement to move on to the next call. So then law enforcement is not tied up sitting in a crisis stabilization unit or tied up sitting in a LPS hospital waiting for the intake. Their time is much better served out in the field, keeping the community safe. So we travel to and from the calls separately from law enforcement.
Perfect. And then I have another question. How quickly is the CCRT able to get the person in crisis? Get to the person in crisis?
So that really depends on our call volume. On any given day, we may have 2 to 3 or 4 teams available. We always travel out in pairs for safety reasons. So it just depends on where the call is located at and what our call volume is. So on average, we could be present between like a half hour and 45 minutes. But if we have a really high call volume, then it may be pushed out, an hour or 2. And so just depending on what's going on in that moment, we will let the caller know what our ETA is. And they can make a decision on, if they want to wait for us or if they want to go ahead and handle the situation on their own. And then maybe we would be able to support later on. But it just really depends, what's going on in the moment with our teams.
And another thing that I want to highlight that and mention is that remember, we always have our triage engagement support teams co-located in most of our police stations and sheriff stations here in San Bernardino County. I believe there's only a couple of city police departments that we don't have co-located staff at. So usually what will happen is that law enforcement will call their test team out first to assist with that situation. But if, let's say, that test member, that social worker is already responding to another call from a different officer or deputy, then they usually call community crisis, the CCRT team, the mobile crisis response team. So that's kind of like their backup. And then of course, if that person is out of the office, then they will also rely on the community crisis response team.
Okay, the next question is, I see that you work with Regional Center and people with intellectual and developmental disabilities. At what point during the contact do you contact Regional Center when a person is in crisis?
That's a great question. I don't have anybody here right now from Inland Regional Center, but we usually, and Erin usually, maybe you can also assist with this question, but we don't usually call Inland Regional Center to handle crisis calls because currently they do not have a crisis response team or something similar to that. However, our CCR team does a great job at trying to obviously work with them to do some of that crisis intervention and stabilization. If they are experiencing a crisis because it's a mental health or a behavioral health condition, because they can have both, then they'll do the linkages to our crisis stabilization unit for that stabilization as well, or other community supports. Usually what we will do is provide a courtesy call to Inland Regional Center for the after hours, or educate the family that there's an after hours number so that they can call and notify their worker of the incident that occurred so that they can follow up and work on those behaviors in that crisis situation, and hopefully work on some behavior modification techniques or anything like that to help future crisis response. Erin, did you want to add anything to that?
Yeah, I was just going to say, even though the IRC does have a crisis line, they are not field responders. So if you reach out to their crisis line, what that does is it kind of puts like a red flag up for that consumer. And so then their caseworker will call them the next day and support the family and support them as, you know, they'll go through their business process, but they don't necessarily respond out in the moment to the field. So CCRT will do everything that we can to support the family, to support the consumer, and you know, make the best decision in the moment based on what's being presented, and then we'll work with reconnecting the family to IRC so they can get the treatment needed.
Thank you. And that's the last question that I have from the chat.
All right. Tamika, do we want to end it now, or do we?
Yeah, if nobody else has any questions in the chat or wants to ask their question live, you can always raise your hand. Otherwise, I'm getting a couple of questions regarding access to the information from the presentation itself, like if the PowerPoint will be available and the recording. I know we at some point will be making the recording available, and then the PowerPoint, I'll digress to you, Miriam, in terms of sharing
Absolutely.
the
What I
presentation.
can do is I can, let me see, I can, let me give you my email address and you can email me, and I can send you my email address because I'm not sure what other format we would be able to publish it.
And if you want, Miriam, I can simply, I have the roster. We can just email it out to all the participants.
Absolutely.
So we'll be happy to go ahead and share it in that format with everyone in the group if that works. With no further ado, I don't see any other questions. It looks like Miriam has placed her information into the chat. And yeah, that looks like that's all of the questions that we have. So unless there's any other questions, I would say we can go ahead and close it out.
Well, thank you, Tamika, and thank you, Casita, for having us. Again, we just want to reiterate that if we can be of any assistance for other communities on establishing their CIT program or establishing crisis systems of care or programs, please feel free to reach out. We're more than happy to share what we've learned and what we've, how we've gone through and implemented those programs. So thank you so much for having us.
And with that, I don't know if Marla wanted to say a few words as the chair of CASITA, But so I'll go ahead and I'll turn it over to Marla, and then we will go ahead and in the meeting for today.
Well, I just wanted to thank everyone for taking their time. I know everybody has busy schedules. We really, truly appreciate here at Casita you taking the time to learn about this incredibly valuable and very diverse program within San Bernardino County. And please stay tuned. We have additional trainings coming up. You'll have an opportunity to learn about the Ventura County CIT program and also the San Mateo SMART program. So thank you very much. Have a good day and be safe.
Thank you, everyone.